Hi, welcome to Tune to Health, a health awareness channel. Today we will discuss the silent signs of diabetes. Understanding these signs is crucial for timely intervention and effective management of your health. By the end of this video, you'll learn the key symptoms of diabetes, how to take action if you suspect them, and tips to protect your body from complications. We'll also provide practical advice on preventing diabetes. Before starting this video, please subscribe to our Tune to Health channel and hit the bell icon to stay tuned for more health-related videos. Now, this disclaimer. This channel does not offer any medical advice. These videos and all comments and messages are provided solely for educational purposes and are not intended to replace professional medical advice, diagnosis, or treatment. Please always consult with your doctor or other qualified healthcare professionals if you have any health-related questions or concerns. Diabetes is a chronic medical condition characterized by high levels of glucose in the blood, resulting from either the body's inability to produce sufficient insulin or the inability to use insulin effectively. Insulin, a hormone produced by the pancreas, helps regulate blood sugar levels by facilitating the uptake of glucose into cells where it is used for energy. There are two main types of diabetes. Type 1, an autoimmune condition where the immune system attacks insulin-producing cells in the pancreas, and Type 2, where the body becomes resistant to insulin or the pancreas fails to produce enough insulin. Over time, uncontrolled diabetes can lead to serious health complications, including heart disease, kidney failure, nerve damage, and vision loss. Patients can present with many signs and symptoms. Here are the silent signs of diabetes. Number 1, excessive urination. Excessive urination, known as polyuria, is one of the early signs of diabetes. This occurs because high blood glucose levels cause the kidneys to work harder to filter and absorb the excess sugar. When the kidneys can't keep up, the excess sugar is excreted in the urine, drawing more water from the body and leading to increased urine production. This can result in a person needing to urinate more frequently, including during the night, nocturia. The body's attempt to eliminate the extra glucose can lead to dehydration and unquenchable thirst, further exacerbating the problem. If you find yourself urinating more often than usual, particularly at night, it could be an indication of elevated blood sugar levels. It's important to consult a healthcare professional to check for diabetes or other underlying conditions. Number 2 is excessive thirst. Excessive thirst often accompanies frequent urination in diabetes. As the kidneys excrete more water to flush out excess glucose, the body becomes dehydrated, leading to an increased feeling of thirst. This is the body's way of trying to replenish lost fluids. However, this can become a vicious cycle. The more you drink, the more you need to urinate. This symptom can be subtle, as many people might not immediately associate an increased need to drink with an underlying health issue. Some attribute it to hot weather, exercise, or other factors. However, if you notice that you're constantly thirsty, regardless of your activity level or the weather, especially if it's accompanied by frequent urination, it could be a sign of diabetes. It's crucial to pay attention to your body's signals and seek medical advice if you're experiencing an unquenchable thirst over an extended period. 3. Unexplained weight loss. Unexplained weight loss, particularly if it occurs rapidly, is another potential sign of diabetes, especially type 1 diabetes. When the body cannot produce or effectively use insulin, it can't convert glucose into energy. Instead, it starts breaking down fat and muscle tissue to use as fuel, leading to weight loss. This can happen even if you're eating normally or even more than usual because your body is not able to properly utilize the calories you consume. This weight loss can be alarming, particularly if you're not trying to lose weight. Additionally, since the body is not getting enough energy from glucose, you may feel more tired and weak, which can further contribute to weight loss and muscle wasting. If you notice unexplained weight loss, especially if it's accompanied by other symptoms like excessive thirst or frequent urination, it's important to consult with a healthcare provider. as it could be an early sign of diabetes or another underlying condition that requires attention. 4. Increased hunger. Increased hunger is another common but often overlooked symptom of diabetes. Despite eating more, a person with diabetes might feel constantly hungry. This happens because the body's cells are not receiving enough glucose, which is their primary source of energy. Due to the lack of insulin or insulin resistance, glucose remains in the bloodstream instead of entering the cells. The body, therefore, sends signals to the brain that more food is needed, even though there's already plenty of glucose in the blood. This can lead to eating larger meals or snacking more frequently. However, because the glucose still isn't being used effectively, the cycle continues, leading to persistent hunger. If you notice that your appetite has increased significantly and you're eating more without feeling satisfied, it could be a sign that your body is struggling to manage blood sugar levels and a medical evaluation may be necessary. Number 5 is fatigue. Fatigue is a common symptom of diabetes that can easily be dismissed as a result of a busy lifestyle or lack of sleep. However, persistent, unexplained fatigue can be a sign that your body is not processing glucose properly. When cells don't get enough glucose, they lack the energy they need to function effectively. This leads to a feeling of constant tiredness, regardless of how much rest you get. Additionally, frequent urination at night can disrupt sleep, contributing to daytime fatigue. The body's increased effort to manage high blood sugar levels also puts additional stress on various organs, further draining your energy reserves. If you find yourself feeling unusually tired or exhausted all the time, even after a full night's sleep or adequate rest, it could be an early warning sign of diabetes. It's important to consider this symptom in conjunction with others, such as increased thirst or frequent urination, and seek medical advice if fatigue persists. Number 6, blurred vision. Blurred vision is another silent sign of diabetes that can develop gradually. High blood sugar levels can cause the lens of the eye to swell, leading to changes in vision. Additionally, you might notice that your eyesight becomes blurry or that you have difficulty focusing. This occurs because the high glucose levels cause the lens to change shape, impairing its ability to focus properly. In some cases, blood sugar fluctuations can cause intermittent blurred vision, which might be mistaken for simple eye strain or aging. If left unchecked, chronic high blood sugar levels can lead to more serious eye conditions, such as diabetic retinopathy, which can result in permanent vision loss. It's important not to ignore changes in your vision, particularly if they occur suddenly or worsen over time. If you experience blurred vision along with other symptoms like frequent urination or excessive thirst, it's essential to get your blood sugar levels checked as soon as possible. 7. Slow healing of wounds. Slow healing of wounds, cuts, or sores is a less commonly recognized sign of diabetes. Elevated blood glucose levels can impair blood circulation and damage the blood vessels, making it harder for blood, nutrients, and oxygen to reach wounds and facilitate the healing process. This can result in wounds that take longer to heal than usual, and in some cases, they may even become infected. High blood sugar also affects the immune system, reducing the body's ability to fight off infections, which further complicates the healing process. This is particularly concerning for individuals with diabetes, because slow healing wounds can lead to more severe complications, such as foot ulcers or infections that may require more intensive treatment. If you notice that minor cuts, scrapes, or bruises are taking longer to heal, or if they seem to worsen over time, it could be a sign that your blood sugar levels are not well controlled and you should seek medical attention. 8. Numbness or tingling in the hands and feet. Numbness or tingling in the hands and feet, also known as peripheral neuropathy, is a common but often overlooked sign of diabetes. High blood sugar levels can cause nerve damage over time, particularly in the extremities. This damage can lead to a loss of sensation, a tingling, or pins and needles feeling, or even pain in the hands, feet, fingers, and toes. The symptoms may start gradually and worsen over time, and they're often more noticeable at night. Peripheral neuropathy can affect your ability to sense temperature and pain, which increases the risk of injuries and infections, particularly in the feet. If you experience persistent numbness, tingling, or pain in your extremities, it's important to get evaluated by a healthcare professional. Early detection and management of blood sugar levels can help prevent further nerve damage and reduce the risk of complications associated with diabetes. 9. Darkened skin patches. Darkened patches of skin are a potential indicator of insulin resistance, which is often associated with type 2 diabetes. These patches typically appear in body folds and creases, such as the neck, armpits, groin, or elbows. The affected skin may become thickened and have a velvety texture. This can be one of the earliest signs of diabetes, especially in individuals who are overweight or have a family history of diabetes. While these skin changes are not harmful in themselves, they do indicate that your body is having difficulty using insulin effectively. If you notice dark, velvety patches on your skin, particularly in areas where the skin folds, it's important to bring it to the attention of a healthcare provider. This symptom, along with other signs like increased thirst or frequent urination, could be a clue that you have or are at risk for diabetes. Number 10 is frequent infections. People with diabetes are more susceptible to infections, particularly in the skin, urinary tract, and gums. High blood sugar levels can weaken the immune system, making it harder for the body to fight off infections. Common infections include yeast infections, urinary tract infections, UTIs, and gum infections. Yeast infections in particular thrive in environments with excess sugar, which is why they are more common in people with diabetes. Additionally, high blood glucose levels can delay the healing process, making infections more difficult to treat. Frequent or recurrent infections, especially those that take longer to resolve than usual, can be an indication that your immune system is compromised due to uncontrolled blood sugar levels. If you experience recurrent infections, it's important to consult with a healthcare provider to determine the underlying cause and take appropriate steps to manage your blood sugar levels. By recognizing these signs, you can take proactive steps for early diagnosis and effective management of diabetes. Early detection of diabetes or prediabetes enhances your ability to prevent or delay the disease and its complications. Adopting a balanced diet, regular exercise, and monitoring blood sugar levels are crucial for reducing your risk. Small lifestyle changes can significantly impact your overall well-being and help ensure a healthier future. Thank you so much for watching this video. Don't forget to follow us for more helpful content. If you liked the video, please subscribe to the channel and give it a thumbs up.